Now, our patient Anita was also having a back pain. She was also taking she was also seeking help from some form of a chiropractor, was treating her for some sacroiliac and neck pain as well. Whenever you have this sort of a history, you always rule out the lumbar pathologies and you should keep your lumbar pathologies in your differentials. Patient can have ankylosing spondylitis. Although she was female at the age of 51, usually ankylosing spondylitis presents very early and more common in male population. And if the patient usually present at the 25, 26 or 30 years of age, and they present quite early with this problem. But the thing which was mainly not going towards ankylosing spondylitis that she was having, although there was pain towards the back area, but there was no actually restriction of movements or range of motion, for example, forward flexion, backward bending, or lateral bending as well. But whenever a patient with hip joint comes to you and complains of this sort of history, you should keep all these differentials in mind, like ankylosing spondylitis, herniated nucleus pulposus, spine trauma, lumbar fractures. All these should be in your mind. Therefore, you have to rule out on your history as well as examination. And whenever if the patient is having this problem or this associated with this actually the ankylosing spondylitis, which is mimicking the symptom, the problem would start at the back level. Patient may have consulted neurosurgeons as well, may have consulted different other specialties as well for his or her back problem, and she may have a history of some form of a trauma towards her back as well. But as in our case, there was actually no history of trauma towards back, although she was having previous back pains, but the problem was mainly towards the hip joint, and from hip joint it was radiating towards groin. It was not the back pain which was radiating towards the hip joint. And in our examination, when we have to perform Thomas test, and when we perform Thomas test, we actually rule out sacroiliac joint involvement. And whenever we are examining the hip, we have to look for whether the fiber is positive or negative. If the fiber is positive, then means the problem is at the sacroiliac joint, but if it's negative, then the problem could be at the hip joint as well.